So good afternoon, students. So we have started with the topic chemotherapeutic agents. In that we have finished general, we have finished beta-lactam, all beta-lactams, and we have finished one of the important chemotherapeutic agent which are acting on bacterial protein synthesis inhibition. Let us see one by one remaining. So there are various agents which are acting on bacterial protein synthesis inhibition. They are why they are effective or why they are comparatively less toxic. We have discussed this earlier, that mammalian organisms are microorganisms are not identical to those of mammalian cells. Bacteria have 70S ribosome, whereas mammalian cells they are having 80S ribosome. The difference exists in ribosomal subunits. We have seen that in human being, we have seen it is 60S and 40S, while here it is 50S and 30S. So because of that, there is a variation because of that, and there are changes in some of the nucleic acid and proteins. So because of that, the structural differences are there. These differences are responsible for selective toxicity of the drugs against microorganism and no harm or comparatively lesser adverse effect on human beings. So this is what beneficial things are there, and therefore these agents are acting. If we classify them, this is only about the drug which are actually acting on protein synthesis. So these are various drugs which are there. Example of these are we can categorize them into broad spectrum, moderate spectrum and narrow spectrum. Those which are broad spectrum, example of these are chloramphenicol, tetracycline. Those which are moderate spectrum, in that these are macrolides and ketolides. Those which are narrow spectrum, in that lincosamide, streptogramins and linezolid. Definitely we have already seen streptomycin into it, which is also a moderate spectrum agent. Now let us see various agents into it. So chloramphenicol tetracycline aminoglycoside, that is streptomycin, which we have seen, were the first inhibitor of bacterial protein synthesis, and most of these drugs are now used for more selected targets. Erythromycin is an older macrolytic antibiotic. It has a narrow spectrum of action, but it continues to be active against several important pathogens, particularly this whole class, we call it as macrolide. It is still useful in respiratory tract infection. They are drug of choice in various respiratory tract infections. We shall see the latter. Newer inhibitor of microbial protein synthesis are there. They are comparatively new. Example of these are streptogramins, linezolid, telithromycin and tigecycline. We shall see these are actually agents from again different classes. Streptogramin is a different class, linezolid is a totally different class, while telithromycin is from erythromycin class and tigecycline is from tetracycline class. So we shall see this drug in their respective categories, classes, how they are acting. We know that there are two subunits. The bigger one is, we call it as a 50S subunit. The smaller one is called as 30S subunit. Before protein synthesis, both subunits should come closer, and when they are coming closer, then on that the messenger RNA will be binding, and on other one there will be transfer RNA will be binding, and because of that there will be elongation, that is initiation and elongation of the chain. This is how what we have studied under genetics or under protein synthesis. Same thing will be happening in microorganisms, and these three codons will be responsible for different amino acids, or some will be start codon, some will be stop codon, some will be initiating agents. So because of that, this will be there, and the transfer RNA will be bringing accordingly various amino acids, and this amino acid elongation will be there. Now these agents will block at one or other level this activity, and by this virtue they will cause decrease, either absence of protein synthesis or decrease in protein synthesis or formation of abnormal protein. Out of that, anything can be obtained or occurring due to these agents. Then what is the mechanism of actions? Most of these are bacteriostatic agents. We have seen streptomycin is a bactericidal. Most of these are bacteriostatic inhibitors of protein synthesis. They are acting at ribosomal level. The exception is tetracycline binding site for this is on 50s. Tetra is acting on 30s subunit, while all other are acting on 50s ribosomal subunit. Chloramphenicol inhibit transpeptidation, that is catalyzed by peptidyl transferase, that is elongation of chain by blocking the binding of amino acid moiety to the charged transfer RNA. So this amino acid will not be binding to transfer, and thus it will not be taking part in the acceptor site, and the elongation will not be the protein chain elongation or addition of that will not be occurring. Macrolide, telithromycin and clindamycin, which will be sharing a common binding site on the 50s ribosome, they will also block transpeptidation. Tetracycline will bind to the 30s ribosomal subunits. They will prevent the binding of amino acids which are charged with transfer RNA to the acceptor site of the ribosome mRNA complex. Streptogamins are the bactericidal drugs, and they will be inhibiting the transfer RNA synthetase activity. It will lead to decrease in the free transfer RNA within the cell. So these are various ways by which these agents are acting. As I told you, most will be acting on 50s subunit except tetracycline, which is acting on 30s subunits. But in any conditions, these all are affecting protein synthesis. Linezolid is mostly bacteriostatic. The drug binds to unique site on the 50s ribosome. It inhibits the initiation by blocking formation of tRNA ribosome mRNA tertiary complex, and this complex, if it is not formed, then it will not initiate the action, it will not initiate the beginning of protein synthesis. Chloramphenicol does not bind to ATS ribosomal DNA of mammalian cell, although it can inhibit the function of mitochondrial ribosome, because most of these are containing 70s ribosomal, and therefore most of the chloramphenicol toxicities we shall be seeing that these are because of the energy related matter or energy production, and it will be affecting it. Tetracycline have little effect on the mammalian protein synthesis because there is an active efflux mechanism, and thus it cannot reach to their intracellular accumulation. Only activity it has got is it binds with, or it can cause chelating action with calcium ions, and that is one of the major adverse effect it can have. We shall see one by one. So first, in that case, we have is a chloramphenicol. Chloramphenicol has a simple and distinctive structure. No other antimicrobial have been discovered in this chemical class. This is still alone after so many, almost 20, 30, 40 years of its formation, or its what we can say marketing. Still it is alone in its class. In all other classes there are so many other antimicrobial agents have come, but chloramphenicol is still alone. No other agent is there which is structurally resembling chloramphenicol. This is very typical, and this is almost unique, we can say, in pharmacology. It is effective orally and parenterally. Also locally it can be used. It is widely distributed. It readily crosses the placental and blood-brain barrier. It undergoes enterohepatic recycling, and small fraction of the dose is excreted in urine in unchanged form. Most of the drug is inactivated by hepatic glucuronidase transferase. Antimicrobial, it has wide spectrum of action. It is bacteriostatic. It is active against some strain of Haemophilus influenza. It is active against Neisseria meningitidis and bacteroides. They are highly susceptible, and chloramphenicol can be bactericidal in particularly this organ, otherwise it is a bacteriostatic in nature. It is not active against chlamydia species, but resistance to chloramphenicol has been found, which is plasmid mediated. It occurs through the formation of acetyl transferases that will cause inactivation of drug. Because of its toxicity, chloramphenicol has very limited uses nowadays as a systemic drug. Once upon a time it was very, very famous drug, very, very popular drug, particularly for Salmonella species. Example is Salmonella typhi, the typhoid fever. So if chloramphenicol would not have been at that time, many people, or there could have been epidemics of typhoid fevers or typhoid disease, we can say mortalities and morbidities. Chloramphenicol was most used and very, very widely used agent for this Salmonella species for treatment of pneumococci, meningococci, particularly in beta-lactam sensitive persons. Sensitive here means hypersensitivity. When I am using word person, that means the person are having hypersensitivity, and in that it will produce the allergic reaction. When we say that beta-lactam sensitive microorganism, that means the microorganisms are getting killed. Chloramphenicol is sometimes used for rickettsial diseases and for the infection which are caused by anaerobic like Bacteroidetes fragilis. Drug is commonly used as a topical antimicrobial agent. It's very common in ophthalmic preparation for ophthalmic infections. It causes GIT disturbances. It occurs from direct irritation and from superinfections. Particularly, it can cause candidiasis. Candidiasis is a fungal infection that is from Candida albα. That is one of the fungus which is opportunistic fungus, otherwise it will cause infection, or the microbial flora will not allow it to cause infection, but this microbial flora, if it is absent or if it is destroyed by these antibiotics, then this will cause, and that is called as a candidiasis. Then it causes bone marrow suppression, it causes inhibition of red cell maturation, it is dose dependent, it is reversible. Because of that, it causes aplastic anemia. It is a rare idiosyncratic reaction. Idiosyncratic word which was very popular, I hope you have studied it in general pharmacology, but now it has been replaced by pharmacogenetics. Still people use it. Idiosyncratic, you should understand, idiosyncrasis means some of the people are genetically more reactive towards it, and because of that, these genetically reactive people, they causes, because of the difference in their enzyme systems, and they cause the toxic or adverse reaction comparatively more than other people. So the otherwise actually it is less. One case in 25,000 to 40,000 patients it is treated, and it is usually irreversible and it can be fatal. It is very dangerous one. Same is the case with the penicillin, but it is not idiosyncratic, it is again allergic one. But yes, definitely genetic setup makes it. In pharmacogenetics we have seen there are variety, or there are changes in these phenotypes, genotypes, which result into changes in the phenotype. Very common or very popular with chloramphenicol. Whenever questions were asked in earlier days when chloramphenicol was in there, in most of that this question was always there, maybe make a pair or MCQs or in small questions, because this was the most common, commonly, or which is most popular adverse effect this chloramphenicol is having, which very few other drugs may be having. That is called as a grey baby syndrome. It occurs in the infants. It is characterized by decrease in the RBCs. Because of that, it becomes bluish color to what we call as a cyanosis, and because of that there is a cardiovascular collapse. There are drug interactions, that is chloramphenicol will inhibit hepatic drug metabolism and therefore it is metabolism inhibitor. Then next drug in that class is a tetracycline. It is chemically having 4 heterocyclic ring, therefore we call it as tetracycline. Drug in this class are broad spectrum bacteriostatic antibiotics with minor differences in their activities. Pharmacokinetics wise, oral absorption is variable. There are many varieties of tetracycline are there. We shall see them. Wide tissue, so some of them are orally absorbable, some are not, some has to be given by parenteral one. There are those which are orally absorbed, their absorption get impaired by food, particularly if it is having cation like calcium, iron, aluminum. Very funny things were happening. I remember, if you remember, recently I told you in our just very recent class, just 2-3 days back, or in previous class, that tetracycline is one of the drug of choice in plague, that is Yersinia pestis infection. And I told you in somewhere around 2000 it was known in Surat, some of the cases of plague were found, and since it has created a big havoc few years, rather almost a century back, in 1920s or something. So there was a big fear among people. Then it was found that it is sensitive to tetracycline. Tetracycline was administered. But many doctors who have not studied pharmacology well, or those who are not much aware, example, those who have done their degrees in Ayurveda or homeopathy and practicing doctors, there were prescription were found that they were prescribing tetracycline, were asking that take with milk, take with food, or take with something like that, or even some have prescribed antacids like sodium, this magnesium, aluminum hydroxide, etc. So all this multivalent, so it may be magnesium, calcium, iron, aluminum, it should not be given because it will form chelate. It is a complex formation, and because of that this complex will not cause or will not allow absorption of tetracyclines. Tetracycline can be distributed in all the tissues and cross the placental barrier. All tetracyclines, they are undergoing enterohepatic recycling. The half-life of doxycycline, minocycline are longer than those of tetracycline. As I told you, tigecycline is a new agent. It is formulated only for IV use, is eliminated in the bile, and a half-life of 30 to 36 hours. It is long-acting. Antibacterial activity, they have activity against many species like Rickettsia, Chlamydia, Mycoplasma, and some of the protozoa they are active against. The resistance mechanism includes the development of mechanism, that is efflux pump, that body will throw it away, the microorganism will throw it away by this efflux pump, and this tetracycline will be thus out of the cell, will not able to act on the ribosomes, and thus it will be there. Further, they will make the changes in the ribosomal proteins, and they will interfere with the tetracycline binding and will not allow tetracycline to bind. This is another way of formation of resistance. This mechanism do not confer resistance to tigecycline, which is a new one. Only exception of multi-drug efflux pumps of Proteus and Pseudomonas, where they throw all type of drugs. So only these are having resistance. Otherwise, tigecycline is a new agent, and very little resistance chances are there. What are chemical uses, clinical uses of tetracycline? Primary uses are recommended in the treatment of infections that are caused by Mycoplasma, pneumonia in adults, Chlamydia, Rickettsia, Vibrios, and some spirochetes. The secondary uses are tetracycline are alternatively drugs in the treatment of syphilis. They are also used in the treatment of respiratory infections that are caused by susceptible organism, for prophylaxis against bronchitis and acne. In acne, they are very popular. Selective uses, some of the tetracycline are used in the treatment of gastrointestinal ulcer, which are caused by Helicobacter pylori. Again, here doxycycline or tetracycline is very, very popular as an anti-ulcer. Still it is used. It is not used alone, but it is used in a combination of other, because it is a just like tuberculosis. It is there. If it respond well to multi antimicrobial therapy. In Lyme disease, doxycycline, and in meningococcal carrier stage, minocycline are found to be effective. Doxycycline is also used for prevention of malaria and in treatment of amoebiasis. That is, it is extension of spectrum, that is protozoas it is affecting. Demeclocycline inhibit the renal actions of antidiuretic hormone ADH, and it is used in the management of patient with ADS secreting tumors, where because of that this ADS activity is more. Tigecycline is a newer one. It is a derivative of minocycline. It includes a broad spectrum action that includes organism resistant to standard tetracycline. The antimicrobial activity of tigecycline that includes gram-positive cocci, which are resistant to methicillin. Then we call it as a MRSA strain, that is methicillin resistant Streptococcus aureus strains. Vancomycin, that is VRE strains, that is vancomycin resistant strains are there. Then bacteria, beta-lactamase producing gram-negative bacteria, anaerobics, chlamydia, and mycobacteria. In all cases, these are used. The tigecycline is formulated only for intravenous use. In that also, one more drug was there, that was oxytetracycline. I still remember it was again in our younger days, it was one of the very popular drug. If somebody goes to doctor, the first injection the doctor will give, that will be oxytetracycline as anti-infective. Or hardly 5-6 antimicrobial agents were available. One sulfonamide, particularly this sulfomethoxazole, and trimethoprim, which were safest one at that time. Second one was another one was this oxytetracycline as a parenteral, or doxycycline as a oral capsule. Third one was penicillins, including ampicillin, a few of the penicillins. Chloramphenicol for typhoid-like fever, and maximum 2, 3, 4 more. So these were only, that much only was the antimicrobial spectrum. You may feel that our generations were lucky, but yes, same time those who were getting infection, and they were suffering a lot. because most of the time the treatments were not responding. Many other were very costlier also, which were new example, fluoroquinolones and some of the other beta-lactam, they were quite costly. Toxicity it causes GI disturbances, it causes mild nausea, diarrhea, it may cause severe, possibly life-threatening enterocolitis, that is inflammation of intestine and colon. Disturbances in the normal flora may lead to candidiasis. Then it is the biggest problem it is making is the affecting bony structure and the teeth, particularly if it is exposed, if the younger generation is exposed, then it may lead to tooth enamel dysplasia and irregularity in the bone growth. You can see the yellowish color, yellowish total half of the teeth are there. So this is that is what incomplete defective formation of the organic enamel matrix over the and this enamel will not be properly formed, and thus the teeth will be having a problem. It is usually contraindicated in pregnancy. Treatment of younger children may cause enamel dysplasia and crown deformation, and thus they will be having more susceptibility of teeth diseases, teeth related problems. Then next is it was known for hepatic toxicity. High dose of tetracycline, particularly in pregnant patient and those with pre-existing hepatic disease, may impair liver function and lead to hepatic necrosis. Renal toxicity, one form of the renal tubular acidosis it will form, that is called as a Fanconi syndrome. It has been attributed to use of the outdated, that is expired tetracycline, because its metabolites which are there or which chemical portion are there, that will be problem. Photosensitivity tetracycline like dimeclocycline may cause enhanced skin sensitivity to ultraviolet light. Vestibular toxicity like dose dependent reversible dizziness and vertigo have been reported in doxycycline and minocycline. So comparatively you will find that this is a group where adverse effects are comparatively more, and therefore these are used very cautiously with then next group is macrolides. As their structure is, if those we have studied it in medicinal chemistry, or if you will study it in medicinal chemistry, you will find that they have got very huge structure. People, the students, they almost curse the person who developed such kind of, or who could find this kind of structure, because so big structure they have having chemically. Therefore they are called as a macrolides, because their structure size is very big. This macrolide antibiotic like erythromycin, azithromycin, clarithromycin, roxithromycin, there are many thromycins are there. So erythro, azithro, clarithro, roxithro, and like that. So many such these drugs are there. These drugs are having good oral viability. Azithromycin absorption is impeded or it is affected by food, just like tetracycline. Erythromycin is excreted via biliary excretion. The T half is 2 hours. Clarithromycin is metabolized by hepatic metabolism. T half is around 6 hours. Azithromycin is eliminated slowly. Half life is 2 to 4 days, and it forms unchanged in the urine. Antibacterial, it is good activity against many species like Campylobacter. Campylobacter, again, this is a class which is responsible for gastric ulcers, chlamydias, mycoplasma, legionella, then gram-positive cocci. Azithromycin, it is also effective in gonorrhea. It is an alternative to ceftriaxone. It is the second, third generation cephalosporin. In syphilis, it is alternative to penicillin G. There are resistance to macrolide in gram-positive organism, involves efflux pump mechanism and production of methylase that adds a methyl group to the ribosomal binding site, and because of that it will not able to bind with the ribosomes, and thus it will not able to affect protein synthesis. Erythromycin is very effective in the treatment of infection caused by pneumonia, that is then Corynebacterium, Campylobacterium jejuni, chlamydia, then Trachomatis, then Chlamydophila pneumoniae, Legionella pneumonia, ureaplasma, urealecticum, then Bordetella pertussis. These are against, they are also active against very too much gram positive cocci, but it is not active against penicillin resistant streptococcus pneumonia and beta lactamase producing staphylococci, but again it is not active against methicillin resistant staph aureus, that is MRSA strains. So although it has got quite big spectrum or broad spectrum, it is not active against some of the agents which are playing important role in the infections of particularly raised place, and they are already resistant to either penicillin or methicillin. Azithromycin has similar spectrum of activity, but it is more active against Haemophilus influenza than Moraxella catarrhalis and Neisseria, that is the species which is responsible for gonorrhea. We call it as Neisseria gonorrhoeae. Gonorrhea is one of the sexually transmitted infection. Clarithromycin has almost same spectrum of antimicrobial activity, clinical uses as erythromycin. Drug is also used for prophylaxis against and treatment of M. avium, that is Mycobacterium avium or avius complex. This is, we have already just had a mention earlier that we call it as a atypical Mycobacterium tuberculosis infection or mycobacterial infection, which is atypical. We do not call it as a tuberculosis because it is not having Mycobacterium tuberculosis, and it is as a component of drug regimen for ulcer which are caused by H. pylori. So I told you regimen word is used. Regimen means where more than one drug is there, then we call it as a regimen. So when this drug regimen, whenever we anti-tuberculosis regimen or HIV regimen or cancer regimen, that means they are never single drug is given. It is always given in multiple or more than one drug, or there is always polypharmacy. Already we have explained why it is the reason why we are doing it. The reason is because of this the chances of resistance or failure of treatment are minimum one. We have seen tetracyclines are effective, then this is another one which is effective against H. pylori is this clarithromycin. Then other agent in that class, that is fidaxomicin, has been proven to be effective as vancomycin for the treatment of C, that is Clostridium difficile, colitis possibly with lower, this is very dangerous difficult one treatment. Adverse effects with erythromycin include GI irritation, which is very common via stimulation of motolin receptors which are present in the these GIT muscles, smooth muscles. It causes skin rashes and eosinophilia. Hypersensitivity based acute cholestatic hepatitis may occur with the erythromycin estolate. Hepatitis is rare in children, but there is an increased risk with erythromycin estolate in the pregnant patients. Erythromycin inhibits several forms of hepatic cytochrome P450 and can increase the plasma levels of many drugs including anticoagulants, carbamazepine, cisapride, digoxin and theophylline. Similar drug interaction have also occurred with clarithromycin but not with azithromycin. Then telithromycin, that is, it is a ketolite structurally related to macrolide. Then drug can be used in the community acquired pneumonia. It includes infections which are caused by multi-drug resistance organism. Telithromycin is given orally once daily and eliminated in the bile and urine. Adverse effect of the telithromycin includes hepatic dysfunction and prolonged of the QTC interval. Drug is an inhibitor of cytochrome 3A4 drug metabolizing system. It is then next is clindamycin. This clindamycin inhibits the bacterial protein synthesis via mechanism similar to that of macrolides, although it is not a macrolide. It is acting against gram-negative aerobic. There is a resistance against gram-negative aerobes because of the poor penetration of clindamycin through the outer membrane. There is a cross resistance between clindamycin and macrolides is a common. Clindamycin causes good tissue penetration after oral absorption. It undergoes this hepatic metabolism, and these both intact drug and metabolites are eliminated by biliary and the renal excretion. The clindamycin inhibit the bacterial protein synthesis via a mechanism similar to that of macrolides. The main use of clindamycin is in treatment of severe infections which are caused by certain anaerobes like bacteriorhides. It is active against community acquired strains of methicillin resistant Staphylococcus aureus. It is recommended for prophylaxis of endocarditis in valvular diseases patients who are allergic to penicillin. The drug is used in combination with pyrimethamine for AIDS related toxoplasmosis. So that is pyrimethamine, and this is used for toxoplasmosis, but in AIDS where immunity is reduced. Toxicity of clindamycin that includes gastrointestinal irritation, skin rashes, neutropenia, hepatic dysfunction, and possible superinfection like Clostridium difficile pseudomembranous colitis, because this is happening because the microbial flora is not there, therefore we call it as a superinfection. Then next drugs which are comparatively newer, we call them as streptogramins. Example of these are quinupristin, dalfopristin. It is a combination of two streptogamin which are bactericidal and has a duration of antibacterial activity longer than half-lives of two compounds. That is, we call it as a post-antibiotic effect. Antibacterial activity includes penicillin resistance pneumococci, methicillin resistance Staphylococcus aureus, vancomycin resistant Staphylococcus aureus. So you can see that they are active against most of the this resistance strains which like penicillin resistant pneumococci, methicillin resistant Staphylococcus aureus, vancomycin resistant Staphylococcus aureus, etc. They are administered intravenously. The combination may cause pain and arthralgia myalgia syndrome. They are potent inhibitors of cytochrome P453A4 subtype of this enzyme, and therefore it increases the plasma level of the drugs which are metabolized through this cytochrome P3A4. We call it as a enzyme inhibition or metabolism inhibition of these drugs. Then next in that class is linezolid. It is a first class of novel class of antibiotics. We call them as oxazolidinediones. This oxazolidinones. This linezolid is active against drug resistance gram positive cocci, which includes strains resistance to penicillin like this methicillin resistance Staph aureus, penicillin resistance Streptococcus pneumoniae, and vancomycin resistance this E. coli. Drug is also active against this L. monocytogenes and corynebacteria, particularly it is a diphtheria bacteria. It is available in oral and parenteral formulation. It is metabolized by the liver and has got elimination half-life of 4 to 6 hours. Thrombocytopenia and neutropenia can occur most commonly in the immunosuppressant patients. Aminoglycosides are the last in that. We have already studied it in more detail than this. So these are the various agents which are used, which are which are affecting protein synthesis. Now we shall go for other classes in our next lecture. They are active or they are useful in various treatments.